All right, let's go ahead and jump in and talk about case studies. So the foundation of case studies is based on the clinical judgment measurement model. You as a nursing student don't necessarily need to know everything about the clinical judgment measurement model, but it provides a little bit of an idea for the foundation of why they're written the way they are. So we can go ahead and briefly pull that up if possible, and we'll talk through a little bit about what that looks like and how it works with a case study. So the clinical judgment measurement model was written by the NCSBN, who of course make the NCLEX, and there are 6 steps, and it kind of mimics the nursing process. Are we able to pull up that slide for the clinical judgment measurement model? So this is very much something that nurse educators will use when they're writing case study questions. Okay, here we go. So you can see here on the purpley pink side is the nursing process. This is what you definitely learn in nursing school. You know, you assess your patient, you analyze, you plan, implement, and then of course always evaluating to see how interventions worked out. Very similarly, on the other side, the green and blue, is the clinical judgment measurement model. And this is, again, what educators use to decide how they can test whether or not nursing students have good clinical judgment. So it looks very similar to the nursing process. We've got our recognizing cues. So it's just sort of like you're being a detective and you're noticing things that are going on with your patient. And then analyzing cues is the next one down. That means you're taking those clues and trying to figure out what's going on, coming up with some theories. And then we have prioritize hypotheses. So you take those theories and you figure out, well, what's most urgent? What do I need to address right now? And then we have our generating solutions. And this is when we're like, okay, we know what we think is going on. How can we help? And then we've got take actions below that. And it's like, how do we help? What are we actually doing with this patient? And then evaluating outcomes. And then again, always it's this like circular process of ongoing evaluating what we've done. How can we improve? Let's start from scratch and say, like, how are we looking now? What can we do with these cues that we're seeing? So that's the clinical judgment measurement model. And you notice there are 6 steps there. And then the 6 steps are going to mimic the 6 questions in the case study. So we'll switch over back to the case study and talk through how each of these steps applies to the case study. All right, so here you see this is the UWorld platform, but we very much designed it to mimic what the NCLEX looks like. So these blue bars, the white split screen, this is everything that's NCLEX. So that's where we took it from. And this will kind of make you feel more comfortable when you actually get to your NCLEX, because you can see it'll look familiar at that point. So when we're talking about a case study item, it's an NGN kind of newer item style, it will always have a split screen. That's how you know you're in a case study. You can see other questions that are split screen like this, but they're not always in a case study. So you'll have either a single question with a split screen, or you'll have a case study, which is a set of 6 items. It's always 6 items, and they're in a split screen setting like this. So let's go ahead and dive in. This is the screen as a whole. This is what you'll see. And you'll always see both the left and the right side for these next gen item types. Let's dive in and look a little bit closer at the left side. This is going to be your clinical data side. It should be a little easier to see now. And what you can notice here is that there are tabs. This one in particular says nurses notes. There's lots of different kinds of clinical data you can receive. And the idea here is that you're using your knowledge to interpret what's going on. And the first step, this is our first question in the case study, which means we're recognizing cues. So we're being a detective and we're looking for details that are happening with our patient so that we can figure out what's going on. Here you'll see there's a gray bar. This scenario applies to the next 6 items. So you know you're in a case study. And then it tells you here item 1 of 6. So that lets you know as well. And then, you know, we've talked about before the NCLEX test design for NGN, Next Gen NCLEX, is to have a minimum of 3 case studies when you're taking your NCLEX, and you will see those in your first 85 items when you take your NCLEX, and you'll get at least 3, and those will be scored. You may see up to 1 or 2 more, but those will be not scored. They're in pre-testing, which is what they call it when they're experimenting questions to see if they're going to perform well, if students are understanding the right things when taking those questions. So you can see 3, maybe up to 5 if you get 2 experimenting case studies on your NCLEX. Those will be within your first 85 questions that you answer. And again, every time you take an NCLEX, 15 out of those 85 questions are not scored, they're experimenting. But you know you'll see at least 3 case studies in that first 85. You won't know which ones are scored and which ones aren't scored, so do your best on every one of them. So this is what it'll look like. We have item 1 of 6. It gives you a little bit of information at the top. The nurse is caring for a 20-year-old female client. They try to exclude gender if it's not important, but here we must need to know that they're a female client, otherwise they wouldn't have told us. Let's look here. So we have our first tab. It's called Nurses Notes. It won't always be one tab. It could be 2, 3, up to maybe 5 or 6. But we can see here the setting is the emergency department. It gives you a time frame, and it tells you all these details about the patient. So you'll have to review all this information. And again, first question is the first step, and that's recognizing cues. So we're investigating. We're looking for things that can tell us what's going on with our patients. So just, skimming. They've got a sore throat, we can see. They've got polyuria. They've got menstrual period information here. So you're going to read through all this. They've also got vital signs, and think to yourself, which ones are sticking out? What are cues that I need to be paying attention to? So that's what's happening on the left side of the screen. And that's going to happen every time you answer a case study question or another split screen NGN item. And then we can switch over now to our right side of the screen. And this is going to be your question that's attached to the case study or the case study item. So this one in particular is a highlight item, which means that it looks just like the other side of the screen. It won't always look that way. It can be any type of question on the right side of the screen. It can be a single best question where you just have to answer one simple 4-option question, or it can be a SATA or other type of question. But in this particular case, it's a highlight item. What's unique about highlight items is that you go through and have an idea of what those cues are, but you're not actually told what you can click on until you hover over the options. So you can scroll here and say, like, you know what, I really feel like that sore throat might be important. And you can see here, yep, it is an option. It's pale yellow, which means you can click on it. And then it turns a dark yellow, which lets you know that you did choose that as an answer option to respond with. And then you can continue scrolling and you think, wow, that 4 episodes of emesis might be important to follow up on, but it's not something I can click on here. So we'll move on. And you can see abdominal pain. Well, I can't click on it. So continue scrolling down and see what's available to click on. Pregnancy status is unknown. Is that something we should follow up on? I don't know, but maybe we'll go ahead and click it. But we know that we can click it here. Let's see, what else can we pop up with here? Pale yellow, here we go again. Patient appears drowsy. We can click that one as well. If you change your mind, you can just click it again and say, never mind, I don't think that was right. And you can go through and say, what all can I click? All right, respirations you could click, pulse rate, and you go back and forth here and you make decisions on this. This question in particular doesn't tell you how many answers are right, so if you wanted to, you could click all the options. That wouldn't give you any advantage for answering the question well. This is one of those scoring models where you get subtracted a point if you've answered an incorrect option. So there's no advantage to clicking every single option. That's not going to help you. You're going to get points for the correct options, but you're going to get points subtracted for the wrong options. So this is one where you want to be careful, and sort of like entering or answering a SATA item, which you've done a million times before, you have to make decisions about which ones are important and which ones are unimportant. I'll just pick a few of them and we'll see how we do at the end here. All right, so let's move on from here. This again was the first item of the case study. If you're just joining in, we're in the middle of the case study. We're still on the first one, and the idea here is that we're recognizing cues of what's going on with our patient that we should follow up on. I'm gonna hit submit here. And this tells you that you can return at the end of the question set to read the explanation. Of course, UWorld, we pride ourselves in our explanations. This is how we provide information to our students and teach. So you absolutely want to click previous when you're done with the case study set and come back here and review the explanation. But for now, we're gonna move on to the next question. All right, let's look here at the next one. You can see here on the left side of the screen, we still have the same set of notes, same emergency department, and these notes that are presented, they're never going to remove information away from you. They're never going to provide information and like change the wording to trip you up. They may add information, like here we have an interval of 8:45 and we give information here, and you may notice that we get some information at 10 a.m., but they won't change what was already here. They'll just add on like a 10 a.m. interval. They may also add on a separate notes tab, like, hey, maybe you get some lab results that'll help inform you for making your decisions here. Let's see, what else to note that's important? But we'll talk more about that. I believe this particular case study does have an occasion where it adds information, so we'll see that more. But having the same information we've already reviewed, we can look at it again, but now we have a new question on the right side of the screen. So we'll switch over and look at our question this time. So instead of a highlight, this time we have a matrix multiple response item. So what you're going to see here is it looks very much like a SATA question that you're used to answering. You get answer options in rows and you can check them or not check them. I'm trying to remember just for a second. Right, so you can check as many as you want on a SATA or a select all that apply item, which you're used to seeing, of course. So this one looks similar, but it looks like there's 3 in a row and 3 columns, which obviously makes it a lot more complex. So like any SATA item, you could select every single option if you wanted to. The idea here, being the second item in the case study, is that we're analyzing cues. So we've taken what we recognized from the first item and we're breaking it down to say, what could this mean? What can I figure out based on what I've noticed? Here, we're deciding what could this mean in the context of what disease process could be going on for our patients. So what's causing their symptoms? So here, what the question provides us as options are diabetic ketoacidosis, ruptured appendix, ruptured ectopic pregnancy. So then each time we go through one of these columns, I always like to go column by column here because it tells you at the bottom, note each column must have at least one response option selected. So we can't answer the question without one column filled in, or one column with at least one box. So we'll go through and like click some options. Similar to the last one, you could, if you wanted to, select every single square in this entire grid. It wouldn't help you because every time you select an incorrect option, it will take a point away. So that's not going to help you. We really want to be careful and say like, okay, diabetic ketoacidosis really is associated with these findings versus a ruptured appendix. What's neat here is that you're kind of figuring out what disease processes overlap. So of course, something like abdominal pain, you're going to see that in all 3 of these conditions. I feel confident about that. So you're going to click it all the way across the board. And we already have 1 in each column. So then you kind of have to make your differential about what also goes with those disease processes. It's pretty complex. So here we basically answered 3 separate select all that apply questions. And we're going to scroll back to the top and see if there's anything we missed up here. Include the instructions for how to answer it. Okay, this looks good. We're going to go ahead and hit submit. And on the NCLEX, once you hit submit button and once you hit that next button and you move on to the next question, there's no going back. You may see something in the next item and you're like, oh, dang, ruptured appendix would have made more sense, but you can't go backwards. So just pivot, do your best from there, and choose interventions later on that would match ruptured appendix, even if before you thought it was a pregnancy problem. So let's go ahead and look at question 3 here. And like we talked about with the clinical judgment measurement model, question 3 is our prioritizing hypotheses. So question 2, we took our time, we decided what could be going on based on the symptoms. Now we're deciding what's most important for what's going on. We got to rank priorities, which is that kind of that management of care level of thinking process. So again, we have our left side screen as always. I don't see any new information here, and there's no line that tells us they've added information. So we can review it if needed, but it's the same information as before. So we're going to go ahead and switch over to our right side screen. And we're just splitting it for viewing on this platform. You'll see all of it when you're answering the question. All right, here it says, complete the following sentence by choosing from the options. All right, based on the clinical findings, the client is most, so here again, we're prioritizing hypotheses here, is most at risk for blank as evidenced by blank. So let's see what we can click. All right, maybe we think it's peritonitis and sepsis. And if you try to hit submit here, it'll prevent you from moving on the NCLEX. You get a few more options on the UWorld platform. But once you hit submit, again, like you can't change your answers. But you would fill in both blanks, and you can note compared to the previous items, this one isn't telling you, or it's not giving you the option to click a bunch of checks. It's telling you very specifically, there are 2 places I want 2 options from you. So you're not going to have points received, or you're not going to have points subtracted for answering incorrectly because they told you to give them 2 answer options. Instead, you'll get points for correct options and then just 0 points added for an incorrect option selected. So that's a little bit different, and it's a little bit easier because they just tell you how many options they want from you. Let's move on to the next one. So this is going to be, oh, and you can go ahead and take your time answering this item. For the first one, based on the symptoms, abdominal pain, I think periods, but you know what? I'm starting to think with the vomiting, we're going to be worried about fluid volume here. And then for our second blank, we're just kind of, and you can see here from the wording, as evidenced by, that tells us that we want you to provide the rationale for what your answer is. And here we can say, as evidenced by, probably, could be a number of things, maybe the vital signs. So we would click that and fill both the blanks in, and it wouldn't let you proceed until you have both blanks filled in. All right, so let's move on. Oh, the answer. I don't know the answer yet. Sorry. Yeah. It actually won't let me click it, but we'll look at that when we review. All right, let's move on to number 4. And again, you can see up here in the top, it's telling you what question number you are of the set. And then also it says it over here, item 4 of 6. And what's exciting about this one here is that you see this new line has been added above the question. Sorry. Yeah, I'm on the right side. Thank you. Can't read my mind. All right, on the right side of the screen here, looking at the question, there's this note that says, the nurse has reviewed the information from the laboratory results. They're telling you, hey, you, the nurse, go ahead and review the information from the laboratory results. So we're going to be particularly attentive to the left side of the screen. If we could switch back, please. Here we have, these are the laboratory results. So we've got some new information here. They didn't say nurse's notes, but we could go ahead and just double check. Oh, there's no information added there. But definitely we have our laboratory results added. So this will inform our decision making from here going forward. And it will answer some of our questions that we've had throughout the case study. You may still be on the fence like, oh, I really feel like this could be a ruptured ectopic pregnancy, or it could be DKA. We're not sure yet. This information will probably help you narrow down and figure that out. Because we're on item number 4, that means generating solutions as a step. So we're actually going to be choosing things we can do to help this patient. So it does make sense that they're going to give you some information that will more definitely tell you what's going on. So here we have a glucose and a potassium. What's really cool about the NCLEX since they've launched the next gen is that they give you the normal range values for what it should look like. So no longer do you have to make sure you know 3.5 or 3.6, depending on what your school said, for the range when you evaluate the test result. Now it will tell you, we're expecting you to know that a normal range is 3.5 to 5.0. So then you can go over here and interpret, wow, 5.7 is too high. So that's really helpful. You'll always get this range going forward on the NCLEX. That was one of the changes they announced, which is awesome. So having this new information in mind, we can go ahead and switch back over to the right side of the screen. And we have our question. This one will look very similar to a SATA, a select all that apply question you've seen a million times before. It just has a whole bunch of answer boxes and it doesn't tell you how many to answer. There are some types of NGN items for the NGN launch that they'll tell you like, hey, I want you to select 2, and it'll tell you that in the question stem. But this one just says select all that apply, nice and vague, which is why we struggle with these kind of questions. But it says, which of the following interventions should the nurse take? And if you guys have ideas here, please feel free to put your answers in the chat. All right, let's see. After reviewing those laboratory results, we can even see here dextrose as an option, which we got the glucose, so that's starting to feel really relevant here. So we can go through and select some options. Let's see, dextrose, which I know is part of DKA treatment, absolutely. So I think we can say confidently that these interventions here, this is related to high potassium, which we know they have a high potassium now. Checking blood glucose, since I feel confident now that this patient has DKA, that one feels very natural. Of course, anytime we've got potassium concerns going on, we're having a high potassium, we're having an intervention to treat potassium, always going to think about cardiac monitoring, so that's absolutely appropriate. So those ones make sense to me, but feel free to think those throughout yourselves and put them in the chat. And again, this is one of those questions where they don't tell you how many answer options they're looking for. I could select every single box if I wanted to. That wouldn't help me, because every time I select an incorrect option, they're going to take away a point, because they haven't told me only select 3. They've told me as many as you want can be right, but that doesn't help to select them all. So we'll do that, submit. And then this is just the UWorld reminder that says return. This is not on NCLEX, but it's like, hey, UWorld has given you these great explanations. Don't forget to come back. But we'll click next, and again, we can't go backwards now. Now we're on to item number 5 in our set, and this one is our taking actions. So a lot of times the questions are going to be similar to item number 4 because they're all about what are we doing for this patient. But here particularly we're narrowing down, like it's more like item 4 where you're generating solutions. Oftentimes it's more like a plan of care or a care plan. We want to say like generally we're going to like improve nutrition, so we have some idea about what diet they should follow, or generally we want to like avoid safety problems, so like maybe fall precautions, like big picture stuff. Now item 5 we're talking about taking action, so it's going to be things like, okay, fall precautions is a concern, maybe the question option is turning on the bed alarm. You're going to narrow down and say, like, what am I actually doing when I get to the patient's room here? So that's item 5, taking action. And again, it's the 6-item set, so we're almost there. And the left side of the screen has not changed, so we don't need to look at that again. And we also know that it hasn't changed because we don't have a prompt here that says the nurse has reviewed information from the new tab. So let's look at this item type. This one's new. This is a drag and drop item. So you're going to be able to take these word choices and put them in the boxes here, which is pretty cool. So it kind of feels familiar to that drop-down item we had before where you clicked and it gave you a few options here. And it's scored the same way. Because they tell you, I want you to give me 2 answer options, they're not going to take away points for answering additional answer options because you can't. You can't fill out 15 click boxes. You can only fill out these 2 that they told you they want you to fill out. So you won't lose a point for clicking a wrong answer. You'll just get 0 points for it. And then you'll get a 1 point added for every time you select a correct answer. So here, let's see, the nurse should administer blank and blank at this time. For this particular drag and drop question, it doesn't matter which order you put it in. You could say, I'm going to give the saline bolus, and I'm also going to give the regular insulin. Or you can, well, I think you have to drag it back first, actually. You can give the regular insulin, and you can give the saline bolus. And then you can flip them, and you could say, oh, I'm going to give the saline bolus first. So I'll move that one over here. And then I also want to give the insulin. The order doesn't matter because it's just saying this and this. There are some questions that are drag and drop where the order does matter, but it's going to be really apparent from the phrasing. It's going to say something like, I should administer blank because of blank, or I should administer blank before blank, or it might ask you to provide the rationale for your action. I'm going to do this because it will lower the potassium. So it's pretty intuitive and it matches the phrasing of the sentence. So do be cognizant that sometimes it does matter what order you put it in, but here it's just blank and blank. It can go either way and you can still get the question correct. So it won't let us move forward until we filled in both of those, but now we have. So we'll go ahead and click submit, and feel free to put your thoughts on the answer options in the chat, and we'll look at them together when we finish up. All right, this is coming up. We're going to hit next, and we're going to go on to our last question of this case study set. This is item number 6. And again, thinking about the clinical judgment measurement model, we know the idea here is to evaluate outcomes. So you won't see an item here where it's saying like, what symptoms are cues, or what are you concerned about? Instead, you'll see what is the outcome? Have they improved or declined? That's one of the frequent ones. Or what shows that they understand some instructions that you provided. We've already done our intervention. We're evaluating how it went now, which is definitely part of the nursing process. So let's look at item 6. We're not getting any more information on the left side. So we've already read all that. So we'll just switch over and look at the right side. Here it says the nurse is providing teaching about managing diabetes so that they don't get DKA again, is the idea here. And then we're evaluating client statements, which is always a fun type of question. to decide whether or not what they're saying is meeting the objective here. So let's go through. This is a matrix multiple choice item, sort of like the other matrix multiple response item. You'll get some instructions that tell you. The other one said you have to answer something in every column. This one's different. It says you have to answer something in every row. And specifically, each row has one answer option. This is more like a multiple choice question where you have to answer, or more like kind of like a true false even, where you just have two options to click. If I click this option, I should not take it if I can't eat due to nausea. If I select this as correct, I can't also select incorrect. It's either or. So that's a little bit easier. And then again, we know that the NCLEX is telling us, I want you to give me one answer for each of these rows. 1, 2, 3, 4, 5. So we're going to go through and answer each row with what we think is the correct answer. And then it's easy to change your mind on these. But again, it prevents you from answering more than that. You're given 5 answers. It asks you to give 5 answers. You have to give 5 answers before you can move on. So it's not going to subtract points away from you for giving a wrong answer. They said, give me 5 answers. So you'll get a point for a correct answer, and you will get 0 points for an incorrect answer, which is really helpful, because then you're not always losing points for wrong answers. So we'll give you guys a second in the chat if you want to put your thoughts about how we're going to treat DKA here. Of course, we know DKA is an acidotic state due to not being able to transport glucose into the cells. We don't have enough insulin to do that. So we provided care and given a lot of information to our patient, and we're hoping that they're walking away with a correct understanding. Alrighty, let's go ahead and hit next here. And then it's going to ask us, this is a, well, hold on, submit with that. Yeah, okay. That's going to ask us if we want to close out the exam. For that, though, you can hit submit, and that last answer option will unlock all the explanations. So here you can go back, and this is like our UWorld bread and butter, get the explanations for every single question, which is super helpful. And it kind of tells you like where you might have gone wrong, because even if you have gone off in the wrong direction on questions 1 and 2, you can pivot and course correct and then do the correct actions on 3, 4, and 5. And reviewing them will help you know where you might have gone off the rails. So let's just for a second here, we don't need to go through the whole thing, but let's go back to question 1 and say, all right, here we got this option correct, this option correct. We did not highlight this option that was supposed to be correct, so we missed one there. And then also here, we did not get one of the correct options that we should have. And then here, we selected an option that we didn't need to select. So we will be getting a certain number of points, subtracting that one, adding that point, adding that point, and adding that point. But we're not losing points for the ones we didn't click. We're only losing points for the ones we entered incorrectly. And what's really cool about UWorld is we've talked a lot about these scoring methods in the past few minutes, and it can get really confusing. But what UWorld does really well is tells you here what the scoring rule is. It tells you you got 2 points out of 6 maximum points. And if you're like, how did I get there? You can always click this little infographic about the scoring rule, and it'll break down for you, like, how do you get points and lose points on questions like this where you can select up to all the options? So this is super helpful. As a student, you don't necessarily need to know all the scoring rules. Really just answer the questions to the best of your knowledge. If you can click every single box that's available, don't do that. That's not going to help you if you're just clicking every box you can. But that is super helpful if you're just like, I really don't get why I missed that point. You can click that there. And then here are beautiful UWorld explanations. It breaks down for you in this particular item each of the answer options, and it's going to tell you why every answer option was right or wrong. So you'll find the answer options here in bold based on where they were in the question. So you really walk away from it with new information. If you've forgotten some stuff about DKA, you can learn that from this and why you might have gotten the answer option wrong. So, and then we summarize it up for you down here. So let's go to the next one. Again, just reviewing how we did. It'll tell you, hey, you did a great job here. You got this answer option correct. You missed this one here, but we're not going to take away a point for you missing it. But you were wrong here. We're going to take away a point for that. And then you got this option, you got this one, you got this one, you got this one. So you're kind of collecting points like a video game, like ching, 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 adding points up here. And then again, if you're like, what happened there? It'll break down the scoring rule for each specific item type. So this one being a different item type, it looks a bit different, and it shows you how they added up, which is awesome. And then our beautiful UWorld explanations that we, a labor of love, create for each item. And then some really nice images, of course, here. It'll show you what this means in context of the explanation. And this one I think is really pretty. Well, it's not pretty, it's a dangerous situation, but it's illustrated well. And then question number 3, this was our drop down. Again, this is our 0-1 scoring rule. So we got 0 points because we answered this one wrong, and then I clicked too fast and this one didn't go through. But this one was wrong, so we don't lose a point. There's no negative there. And again, it explains that for you. You got 0 points for a wrong answer. Really nice flow chart here for how diabetic ketoacidosis works. More images to look at. Oh, and then here we have one of our lecture videos, which is awesome. These are a recent addition to our platform. We're very proud of them. Here you can click and you can listen to a whole, this one is 6 minutes. We try to make them short and sweet so they're easier bite-sized, like on the go, but this one will give you an entire lecture in 6 minutes on diabetic ketoacidosis, everything you need to know. So that is a really helpful addition in this particular case study, and you'll see these all throughout the app on questions they're relevant to, and then also in a library on the front page of the app when you are looking to make an exam in the app. So there's our explanation here. This one being a SATA item, like we said, you're going to lose points for these incorrect options and only gain points for the correct one. So here we've actually got +1 point for a correct, -1 point for a correct, minus another point for an incorrect. But it's not -2. It just takes us down to 0. So +1, -1, -1. It's not -1, it's 0. You got 0 points for this one. It wasn't the best. And it tells you that here. You got 0 out of 6, and of course it'll break down for you how those points are added up. All right, that's item 4, and again, we're in that 6 case study set. We've got 2 more just to look at briefly here. Hey, we did a good job on this one. We answered it correctly. We got check mark, check mark. They told us how many options they wanted, so we got 2 points for answering it, 2 of 2 here. And it talks about the scoring rule. Scrolling down again, we've got a beautiful explanation for every single answer option. You're never left wondering, like, why didn't that one work here? And then again, that link continues here for that DKA lecture. That link is there as well. And then our last one here, again, X's for our incorrect option, and it shows you what would have been correct. And then here are correct options. And this is one where we don't lose any points for incorrect options, so we get 1, 1, 1, total of 3. 3 out of 5, and we didn't lose anything even though that one was wrong. Again, our really nice explanations here, breaking it down. And then our lecture is attached again at the bottom. Let me look and see. I'll leave this up so you guys can figure out whether or not your answer options were right or wrong in the chat. I'm going to look at my notes here and make sure I haven't missed anything. Like I said, NCLEX does not let you move backwards. It's not necessarily a dynamic case study where it would change what question you see based on your answers. It's just an unfolding case study on NCLEX. So every time you answer a question, you'll get another question, but the question you receive doesn't depend on your previous response. Let's see what else we talked about. Scoring rules. Different item types. We covered most all of the item types. And then you'll see a few more also if you're on the UWorld app. And if you want to check out our UWorld questions, you can, of course, do our 7-day free trial on nursing.uworld.com, so you'll see all the item types and get access to all this good stuff for 7 days. Let me see, what else do we want to cover? Anything I missed, maybe? Okay. Alrighty, then we'll wrap up here. Thank you everyone for joining. Please remember, subscribe and follow on your favorite app that you use for social media. Our tag is @UWorldNursing, so your favorite channel, you can subscribe there. And we'll see you next time, and I guess this Thursday we'll have our next session. Thank you.